This is the Best Health Podcast, brought to you by Wake Forest Baptist Health in partnership with MedCost.
Good day. Welcome back to the latest episode of the Best Health Podcast. I'm Justin Gomez, part of the Wake Forest Baptist Health team here. And we're going to have a really cool, interesting discussion today. One that's near and dear to my heart personally. I may or may not have had a foot problem or two in the past, and my podiatrist has been a godsend to me in the past. And so we have a special guest with us, Dr. Dekarlos Dial, and he is with our podiatry department here at Wake Forest Baptist Health. So welcome, Dr. Dial.
Oh, thanks for having me.
How's it going today?
It's going fine.
Good.
You know, preparing for the wintry mix today.
Yes.
I think it's projected that we're going to have maybe 1 to 3 inches of snow in the triad.
Yes. I saw something on social media that said anywhere from 0 to 83 inches. So
0 to 83.
Yes. That's the range. So we'll see how it goes.
So whether it's 0 or 83, the milk and bread have all been purchased.
Yes. I'm going to get T-shirts that say milk, bread, and eggs. So if it does snow, we want people to be able to be safe and get around in it safely, and part of that is having healthy feet. So we're going to talk about healthy feet and what it means to have healthy feet. But before we get into that, Dr. Dial, tell me a little bit about yourself. Who is Dr. Dial, and how in the world did you get into healthcare?
Sure. So I'm Dekarlos Dial, one of the foot and ankle surgical podiatrists here at Wake Forest Baptist. I've actually been living in the triad now for 13 years and also practicing for 13 years. Mm-hmm. I'm originally from Alabama. I moved here 13 years ago from Pittsburgh.
Okay. Are you Roll Tide or Auburn?
All depends. For patient, no, I'm joking. So I'm actually an Alabama fan. Okay. I grew up about 35 minutes from the campus.
Okay.
So certainly I was influenced early on to cheer and root for the Roll Tide roll. So nothing against my Auburn fans. We're all in the SEC, and
yes.
And so I support the Tide. My wife, however, has family from Louisiana, and they're huge LSU fans. So every year we kind of have this controversy, mainly over social media, in regards to who's going to win the upcoming game.
Yeah, that's awesome. So how'd you get into healthcare?
So, the power of mentorship.
Mm-hmm.
So growing up in Alabama, I had a mentor who's currently still one of my distant mentors, Dr. David Roberson,
mm-hmm.
in Birmingham, Alabama. I shadowed him while I was a student, and he exposed me to the field of podiatry, mm-hmm. Some of the benefits, some of the uniqueness of treating several different things, bone-related, joint-related, skin, soft tissue. So just a huge variety of different pathologies that mm-hmm. we were able to take care of. Mm-hmm. And just my time there shadowing him gave me the foresight to pursue the field of podiatric medicine and surgery.
Okay. So from early on, that was an interesting field to kind of hone in on is the podiatry field.
It was. I don't think I ever considered any other specialty other than podiatry.
Okay.
I really enjoyed his office, really enjoyed his patient base.
Mm-hmm.
He was friendly. His patients loved him. During the holiday season, you would go in and see 10 cakes and 15 pies because people love their podiatrist.
Yes.
And I think that's infectious. I mean, the more people you talk to who've had good podiatrists, they think the world of them.
Yeah, like I said, I can personally attest to that. So, I think people listening to this episode, they might have a pretty good understanding of all the services we offer through podiatry at Wake Forest Baptist Health, or they might not know too much about podiatry at all. So if you wouldn't mind, just as a baseline, establishing kind of, I think most people might be aware it's about the foot. If something's happening to your foot, maybe you go see a podiatrist. But if you wouldn't mind just explaining about podiatry and when someone might want to come see a podiatrist.
Sure. Well, podiatry, we treat the foot and the ankle, both surgical and non-surgical.
Mm-hmm.
What's interesting, at Wake Forest Baptist, we have the largest podiatry department integrated within the Department of Orthopedics in the country.
Wow.
We currently have 10 podiatry faculty members full-time. We're currently in the process of recruiting another fellowship-trained podiatrist to work in our department. So we have a huge cast net of people around the triad to really provide care. What's interesting is that most have no idea that they have a podiatry specialist in their community affiliated with Wake Forest Baptist. One thing we've tried to do, along with these type of podcasts, are just kind of going to different offices, various specialties, and making sure that they understand what's available. Podiatry in general, patients may come in with chronic conditions, such as arthritis, flat feet, tendinitis, or they may come in with an acute problem, such as an infection, whether it's related to the bone or the soft tissue, or something as minor as even a toenail. So we do take care of all those conditions.
Okay. That's good. That's good to know. That's a good explanation, because I think some people might think, I have to have something, like I might have to have something really wrong with my foot to go see a podiatrist, like really bad off. But that's not the case. You see a wide range of conditions and issues, correct?
Sure. Aging from the pediatric population up to, adults, and even our patients who are older adults. I would say that in this area, the population for as podiatry patients is pretty broad. Okay,
that's good to know. I will throw this out there. If people are listening, if you want to learn more about our podiatry services, just go to wakehealth.edu and you can search podiatry. You can also call 716-WAKE and we'll set you up if you're interested in having an appointment with a podiatrist. I'll mention that again later on, but I just wanted to go ahead and throw that out there. So, people are coming into your clinic these days, and different conditions might ebb and flow with frequency that you're seeing. But looking at your patient base coming into your clinic now, the last couple of months, what types of conditions are popping up and being some of the more frequent conditions you're seeing?
Sure. So typically around the country, some of the more common conditions where patients present to podiatric offices include plantar fasciitis, which is an inflammatory process affecting the plantar fascial ligament in your heel. Patients coming in with flat feet, I would say Achilles tendinitis, bone spurs, things such as bunions and hammer toes. So those are probably some of the more common conditions that we treat. You have to also consider things that patients may not present to your office, where they may end up going to the emergency room setting. And those are patients that have more of the high energy fracture or tendon injuries, but more commonly patients with diabetes. People with diabetes that may suffer from poor circulation, they may develop a foot wound or a foot infection. It may require hospitalization and surgery while in the hospital to eradicate their infection.
I'm glad you brought that up, and we didn't talk about that earlier, but I think that's so important just with the population base here in North Carolina that might have to have diabetes be a part of their everyday life, that you all are a key healthcare component of people with diabetes for some of them, and I think that's important to point out, that the care and kind of the specialty trained expertise that y'all have to be able to be on the lookout for certain conditions that you might be able to head off at the pass before it gets too bad, right?
Absolutely. I think we all agree that preventative medicine is key. If we can do anything or institute any type of treatment modalities or options to reduce infection rates or amputation rates, then we're successful.
Yeah, that's great. That's I think that's important. I'm glad you brought that up. So, and you brought up another one, and I've been talking with my, out in the community, we have various partnerships with schools and universities and youth sporting organizations and professional sports. And one of the partnerships is with a running organization. And I was talking with them, and just the amount of people that they say come up to them and talk to them about plantar fasciitis. It seems to be a fair amount of people, especially in that can affect, if you're running, walking on a regular basis, and people who like to be active, from what I hear, that really messes up their routine, right? They don't want to mess up that routine. So if you could talk to a little bit about that condition specifically, about plantar fasciitis, and how in the world why does it hurt so bad? And when someone comes into your office hurting, what are some of the options that you work with them on?
Sure. So plantar fasciitis is one of the more common conditions that we see in a podiatric office.
Yeah.
It affects about 10% of all Americans annually.
Oh, wow.
More than 2 million people in a year will end up going to a podiatrist suffering from plantar fasciitis.
Wow.
What's interesting about plantar fasciitis is that the majority of individuals will get better without surgical intervention.
Mm-hmm.
Different causes, the etiology of it. Most patients will wake up and will have heel pain.
Mm-hmm.
They haven't had any trauma. They didn't increase or decrease their activities days or weeks prior, but they will have pain with their first few steps out of bed.
Mm-hmm.
And most will say that their pain will lessen after they step, but the pain never goes completely away.
Mm-hmm.
And then they get into their car and they drive to work. And if they have a long commute, they step down out of their car and they have continued heel pain.
Mm-hmm.
And oftentimes just the repetitive pain, the constant discomfort will prompt them to visit a podiatrist's office. And the question that I routinely get is, why me? Why did I get the plantar fasciitis?
Right, exactly.
Why is it affecting my left side versus my right side, or vice versa?
Yeah.
And the answer is very wide, and it's very difficult to pinpoint the exact cause of plantar fasciitis. One of the things that we all agree on is that if you have a tight Achilles tendon in the back of your leg, most of those people will have an associated problem.
Mm-hmm.
And so when someone has plantar fasciitis, one of the key components involving treatment includes stretching.
Okay.
And not to say that you couldn't have plantar fasciitis from, having a higher body mass index or having a really high arched foot.
Mm-hmm.
Or going barefoot, occasionally. I mean, those are some other things that can cause plantar fasciitis.
Mm-hmm.
I will say that 99% of the time, when someone has plantar fasciitis, they can improve with non-surgical treatment options.
Mm-hmm. Now, I think that's another good point that you bring up. So, you're a surgeon, but there are plenty of non-surgical options available to patients before you have to start looking at surgical options. But you guys are well prepared to travel down both paths, the non-surgical path and the surgical path if necessary, correct?
Absolutely. Over the years, I would say that I do significantly less plantar fascia surgery than I did maybe 10, 12 years ago.
Gotcha.
I think if you can institute physical therapy,
yes,
continued stretching exercise, maybe even supportive insoles or orthotics, shoe gear modification, those things can work. I'll also encourage, if they have severe pain, maybe even corticosteroid injections.
Yes.
However, I do not recommend, repetitive or multiple corticosteroid injections in the same area.
Sure.
And that's very controversial. And I think that's all podiatric surgery provider driven.
Yeah.
I don't think we all will agree on whether you give an injection or not, but I think we all agree on that we want to be very judicious when we give out injections.
Sure. And I like that you brought up the subject of physical therapy too, because our podiatry offices are very well integrated with our physical therapy team. And should someone need physical therapy for whatever condition, I like the team approach that you take in part with the physical therapy team of ensuring kind of a good continuum of care where there's not anyone falling through the cracks or anything.
Absolutely. So we have a lot of correspondence from the physical therapist, They're able to update me on the progress of my patients.
Okay.
If they fail to progress, they will have patients return to the office for maybe further evaluation and treatment.
Okay.
So certainly a multi-team approach works better than just a unilateral approach when you have one provider taking care of them.
Yeah.
And I will submit to you that even before I consider any surgical intervention for plantar fasciitis, patients are seen by a physical therapist.
Yeah, that makes sense. So when patients are coming into your clinic and they're talking to you, does it, I guess I want to touch on the point of there's kind of one-off conditions, but then there are people that maybe have to see you for whatever reason for a longer period of time, and you're there to support them for that whole journey as well, if it is chronic tendonitis or some other sort of condition where they have to see you off and on or multiple times, that you're there to take care of them throughout the whole process, right?
Sure. I think that's one of the beauty of the podiatric specialty is that we function as subspecialists.
Yeah.
So we're able to expand our treatment options for patients and giving them multiple different options. In the past, seeing patients who've been treated in other locations, other specialties, certainly has allowed me to figure out what I think works best, what I think is optimal, but also understanding that sometimes you have patients who may not improve. Yeah. And I think if you're honest and you're very transparent with patients, I think they respect that. Mm-hmm. I think the main thing is they just want to know, what their options are and the best option for them. Yeah,
I think that hits the nail on the head. And I want people to, listening to this, if they're dealing with foot and ankle pain, speaking from personal experience, I don't walk around with this pain for an extended period of time. I don't know, some people maybe have a preconceived notion that it has to get so bad before a podiatrist will see me, or I have to be referred from this doctor or that doctor. For me, when my foot was bothering me, I just called up the podiatry office and they got me in the next day. So I'm sure you would echo that if someone is dealing with any sort of foot or ankle pain, don't sit on it. Don't wait around for it to maybe go away, maybe not go away.
Yeah, sure. So some patients come in and they've been dealing with chronic issues for months, even years. Yeah. It was interesting. They come in and you're able to get an X-ray and give them an idea of what's going on with their feet and ankles, and oftentimes give them a treatment plan, and their pain is eradicated and their function restored, and then they feel like, wow, I've been dealing with this for 6 to 12 months. Yeah. I could have come in 6 months ago and had this taken care of, and I could have had a normal lifestyle, and could have had normal activities of daily living without having this chronic pain. Yeah,
it affects, when you have that foot pain and you can't bear weight on it, it's just, even going to the car, going to your kid's school, going to work, just the daily living, you're exactly right. This is such an interruption. So to be able to rely on you and your team to provide that treatment plan and get people back to their normal level of desired activity is so crucial. And it's funny that you mentioned people love their podiatrists and bring them the cakes and pies around the holiday time. I can totally see that, because if you're not able to walk that well at all, and then all of a sudden you work with your podiatry team, physical therapy, your podiatrist, and you get that normal activity back, that's worth its weight in gold. So I'm sure you get that feedback from patients all the time.
Yeah, I've oftentimes heard patients say, when your feet hurt, your entire body hurts.
Yeah, exactly. That's a good way to put it. We talked about plantar fasciitis a good bit today, because that seems to be more of a common issue these days. As we get ready to wrap up in a minute, any other conditions that you're seeing a whole lot in the office right now, if it's a bunion or tendonitis or anything, that's any sort of patient story that bubbles up to the top of your head here?
It's interesting that you would ask that question. We've, around this time of the year, sports are gearing up, and people are preparing for AAU and travel basketball, even soccer, and baseball is coming up soon.
Baseball, yeah.
And what happens oftentimes in my pediatric population, I have patients that may have heel pain.
Okay.
And heel pain in that patient population is called Seaver's disease, or calcaneal fasciitis. It's basically inflammation around the growth plate.
Okay.
And oftentimes you may see a kid playing their respective sports, and they may start limping as if they're in pain, and some of them are. But immediately following discontinuing their active sports for maybe 24 hours, they have zero discomfort, zero pain. However, as soon as they resume their sport, it flares back up again. So that's very common this time of the year. 100% a non-surgical problem. Patients will get better from it. Their growth plates will eventually close as they continue to grow. And we oftentimes treat them with stretching exercises, shoe modification, insoles, and people do very well with that. Oftentimes an occasional anti-inflammatory. So I would say seasonally, I think that's a very common problem we see in the pediatric population. Now in the adults, this is a time of the year where we see a lot of patients with bunion pain. It's cold, and oftentimes patients have to wear closed-toe shoes.
Yes.
Which can put pressure on a bunion deformity, which is located along the great toe joint.
Okay, so for people listening that don't know, what is a bunion? What happens?
So oftentimes, if you look at your foot, if you have a bunion, you may see where your great toe is migrating and pointing towards your second toe.
Yes.
And you may have what appears to be a knot right on the inside of your big toe.
Yep.
Most of these are hereditary, okay? Oftentimes, patients think it's a bone spur or some kind of cyst or lump or bump, but really it's a bunion. And bunions start off small, they start off mild, and they're more of a progressive problem.
Okay.
Over time, they will typically get progressively worse. Some may or may not hurt. However, if you're wearing a closed-toe shoe and it's rubbing against that bony prominence, or not, if you want to call it that, then it typically will cause some discomfort. In the wintertime, we don't have very many options to wear sandals and closed-toe shoes if it's really cold.
Yeah.
So when they're in those closed-toe shoes, they have more bunion pain. So I would say, for me, I'm busier surgically for bunion pathology in the wintertime.
Okay.
In the summertime, patients are able to wear open-toed shoes and slides and flip-flops, and they don't have as much pressure rubbing on the bunions.
There you go. Well, Dr. Dial, this has been really insightful. Like you said, if you got foot pain, it's just your whole body, your whole daily routine gets messed up. So if anyone listening to this podcast, if you have any sort of ankle or foot discomfort, please give us a call or go to the website, and don't continue trying to walk around with that pain. Like Dr. Dial said earlier, we have one of the largest podiatry teams in the country that's integrated with orthopedics and sports medicine. So, it's very well integrated with the physical therapy team as well. So, wakehealth.edu, you can go on the website and learn more about our podiatry services and all our locations. Dr. Dial said a minute ago, we have locations all over the Triad. So, you can also call 336-716-WAKE. And they will be able to connect you with the right office as well, depending on where you live. So I really appreciate you joining us today, Dr. Dial. This has been great information. So I know you're a busy guy, and I don't want to keep you too long, but thank you so much for being a part of the Best Health podcast.
Well, thank you. It's my pleasure. Anything we can do to educate and provide a pathway for treatment for our patients in the Triad, then I'm all for it.
Yeah. Well, thank you, sir. And I want to thank everyone for listening to this episode of the Best Health Podcast. And until next time, be well.
Thanks for listening to this episode of the Best Health Podcast, brought to you by Wake Forest Baptist Health. For more wellness info, check out wakehealth.edu and follow us on social media. Wake Forest Baptist Health, the gold standard of healthcare.